Hello, OWL members, and welcome to our latest installment of our new Inside the OWL Studio video program. As a reminder, Inside the OWL Studio will highlight one of OWL's partner sponsors and their organization's specific activities and initiatives around diversity, inclusion, and belonging. The format of the program will be similar to a program called Inside the Actor Studio with James Lipton. At the conclusion of the interview, I will ask the same 4 questions of our interviewees. I'm thrilled to announce this month's Inside the OWL Studio will feature Aerie Pharmaceuticals. In 2020, Aerie became a partner sponsor and supporter of OWL, and for the past several years have been actively involved in OWL's Southern California chapter, as well as contributing to panel discussions for various OWL programs. Without further delay, I am thrilled to announce this month's interview will be with Tom Mitro, President and Chief Operating Officer of Aerie Pharmaceuticals. Hello, Tom, and thank you for being here, and welcome to Inside the OWL Studio.
Hello, Abby, and thank you for having us too. It's quite an honor to work with your organization, as you know, and we've done this for a number of years. We're very just happy to do it. We just want to look forward to also continuing through the future.
Wonderful. And Tom, as you know, the OWL mission of advancing diversity and leadership is the driving force behind all activities that the OWL organization develops. Part of any organizational growth is to learn from others, and today I am especially excited to hear from you on not only Aerie's initiatives, but also any insights or takeaways you may have to impart, given your vast experience in the ophthalmic industry. So on that note, I will hand it over to you.
Well, thank you very much, Abby, and again, thank you very much for having us. You know, we all know that based on our experiences, that really our success depends on diversity and all the ways that that term is understood and applied. You know, our commitment to diversity in gender, in race, and background, experience, and thought is really key to important things like, first, sustaining innovation, which is, of course, a cornerstone of our company. Attracting and retaining the very best talent, which is something where we strive to do. Relating to our customers and their patients, as well as our partners and, of course, our suppliers. And really, at the end of the day, simply creating a better workplace for our employees. But Aerie's a relatively small company, Abby. We only have about 400 people globally. So formal initiatives like headcount focused on diversity are both just impractical for us and then necessary. Of course, we're an equal opportunity employer. We fully honor our obligation under law and policy. But at this stage, we don't really rely on diversity programs or targets or quotas to get this right. We just do it. The cornerstone of integrating our corporate culture that effectively focuses us on its mission-critical significance, encouraging us to pursue it within the company and in the industry and communities we serve. First and foremost, our culture is founded on dignity and mutual respect for all. The idea that you treat others the way you want to be treated. We talk about this ethic a lot. We encourage our folks to see the challenges our colleagues are facing and to be accountable first before lying problems at the feet of others. We believe that each person has a vital role to play, an important contribution to make, and that every position we fill in the company is essential to our business. At our size, with everything we're trying to do, we can only succeed together. Which brings me to our second core tenet. Those that produce results share in the rewards. We share our success with the people that help create it. Now, those 2 pillars of our culture working together have shaped a company where top talent is recruited, it's cultivated, it's rewarded in every aspect of our pharmaceutical business, from basic science to clinical development to commercial operations to manufacturing, with all the support functions in between. And we believe that our determination to put the right people in the right position helps overcome the influence of societal basis and individual prejudice. Those factors represent fundamental barriers to our quest for excellence, as well as abhorrent and divisive vestiges of our country's history. So how is this organic approach working for Aerie from a DEI perspective? Well, our general balance is roughly 50-50 with a slight numerical edge currently going to female employees. We also have good representation of all races and ethnicities across all levels and functions. But we know that diversity is a fluid objective. So we look at this as a senior management team every year, thinking about the kind of representation we want in senior management roles, in the field, in our offices, our labs, and our facilities. We always ask, do we reflect the diversity, the dynamism the promise of our marketplace in the world around us? Do our patients, do our customers, our partners see themselves in the Aerie people they interact with? We also evaluate how our employees feel about the environment we are building together and whether we are living our values using our formal measures such as the Gallup Q12 engagement questionnaire. So how do we live these values and encourage diversity and opportunity outside of our walls? Well, we align ourselves with organizations that share these values and our vision for ophthalmology in the country, like yours, Abby. Once we find work we want to support, these commitments are prolonged, which gives us a time horizon to help make a difference and see real progress being made. And where possible, we'd like to get our people involved. I'd note that this support has been provided in some cases before we even had products approved. Continues now, prior to our business becoming profitable. Here's just a couple of examples. Now, within ophthalmology, beyond our growing engagement, obviously, with OWL, we've partnered with Women in Ophthalmology, WIO, to support their summer symposium and engage our team with key projects. Supporting advancement and empowerment of female physicians in ophthalmology mirrors our commitment to support women throughout the biopharmaceutical and healthcare industries. We're in our fourth year of our Give Site Matching campaign with the ASCRS Foundation, a program that supports ASCRS volunteer surgeons in the delivery of free cataract surgery to needy patients. This partnership with ASCRS and ASOA has already helped restore the sight of 750 patients. Now, we recently partnered with the Rab Venerable Excellence in Ophthalmology program to completely update their website, which is a portal for the grant and mentoring program. The Rab Venerable program has established a track record of creating gateways to success in ophthalmology for medical students, for residents, fellows, from underrepresented groups in medicine, or those who want to work in underserved communities. And finally, outside of ophthalmology, led by our CFO, Rich Rubino, we've provided support to the Northside Center in the New York metro area since 2013. For almost 75 years, the Northside Center has provided support to children and families of color facing racial bias and other significant barriers to opportunity, including poverty, of course. The center's outcome-driven behavioral, mental health, and educational services propel struggling children forward, away from the ill effects of poverty and racism, and towards a future limited only by the scope of their dreams. These programs have helped thousands of children. So Abby, that's kind of it in a nutshell from us. And I'll give it back to you.
Well, that's a lot. And I'm very, very impressed what you're doing within the ophthalmic world and outside. And I also know that walking the talk with you is important. You also, from a charitable contribution perspective, work with SightLife, whose mission is to eliminate corneal blindness worldwide, which is just an amazing organization as well. But my key takeaway from everything that you just said is, again, walking the talk, but two words come to mind for me, and that's dignity and respect. And I think when you kind of put everything down to the baseline with diversity, inclusion, and belonging, that really is what it's all about, is treating others as you would want to be treated, whether that's an employee, a coworker, or someone in your personal life. And dignity and respect are those pillars, to me at least. And I was very happy to hear that.
Well, Abby, it means a lot. We're fortunate to have an awful lot of experience working in our company. And what that means is that we have a lot of people that have just been around for a long time. And we've known, as you know, ophthalmology has been very good to not just thousands and thousands and thousands of patients, but also thousands of employees like us that work on the vendor side of the business. And when you get to the situation, you like to sit back, say thank you, and you also like to give back whenever you can. And that's certainly what we like to do at this company as well.
That's awesome. Thank you so much for outlining that for everyone. So I think we'll jump right into these awesome questions that we do at the end of the interview. First one being, Tom, what is your favorite word in ophthalmology?
I thought about this a little bit when I saw the other interviews you did. And I honestly think my favorite word, I think it's the most powerful word in ophthalmology, the one that just inspires the most action, and that is help. If you attended sales training classes that I ran 30 years ago, at Allergan, maybe longer than 30 years ago, but forget it, just call it 30 years ago. I would tell people that the interesting thing about ophthalmologists is you can go into their office. They'll be exceptionally busy. They'll be running around doing a number of things, or you'll see them in a meeting and they'll be behind, they'll run here, run there, they'll stop and say hello really quickly, but they apologize that they've got to get going. If you say, hey, I need your help, the world stops. And they say, well, wait a minute, what can I do for you? And it's funny because I've seen that happen so many times where they forget what they were going to take care of themselves because they want to help somebody. You think about what ophthalmologists are, they're people that do an awful lot of tremendous work, all to the point of helping patients. And they don't stop there. They help everybody that they come in contact with. So I do think that that is my favorite word in ophthalmology, and one that I use when I really need an ophthalmologist to pay attention to what I'm saying, because I know if I say that word, again, everything stops for them and they focus exactly on what you're saying. So I think it's the most powerful word and my favorite word in ophthalmology.
That's awesome. That's awesome. What is your least favorite word?
Well, my least favorite word actually is no, because it's one that I've learned not to take, and ophthalmologists certainly don't either. If you think about what's happened as I've seen ophthalmology through all these years, they're a fantastic specialty, obviously doing everything they do for patients to improve their quality of life through their sight and things along that line. But they've currently certainly get beat up by the government in many different situations with reimbursement and all that sort of thing. All the ophthalmologists do is say no, meaning when negative things come up, they say no, and they persevere, go out and go above it and overcome whatever might be tugging and going the opposite way. We also see it in our business, Abby. We launched a couple of products, and of course, managed care is always a big issue for new products when you bring them in the market. But ophthalmologists did not like the fact that managed care was saying no to them, that they wouldn't allow our products to go through. But as a result, they submitted over 160,000 prior authorization for our two products. That just shows you when they face a barrier, be it reimbursement for the government, anything else, or a product that they want to make sure gets through, they just don't sit there and say, well, I'll choose something else. They say, no, I'll take this head on and I'll overcome it. And that's why no is just something that they don't listen to. And certainly I've learned not to listen to as well.
I love that. I love that. So moving on here, what professional role in ophthalmology, other than the one you have, would you like to attempt and why?
Yeah, that's easy. That's easy. My most favorite role that I would love to be able to take, assuming that it's still available, I'd like to play shortstop for the ophthalmology professional baseball team. I mean, just imagine that schedule if we were sitting here saying, hey, tonight we play the dermatologist and over the weekend we've got a doubleheader against a neurologist. That would be really fun. But if that position isn't available, the other position I'd like to take, perhaps a little more seriously, is I'd like to work for the FDA. I mean, I think it would be fun to be introduced with products from very early stage, in pre-phase 1 all the way through phase 1, phase 2, phase 3. Get to deal with all those products, and you get to deal with all sorts of companies, be it startup companies that are 5, 6, 7, 10 number of employees like we were when we were first approaching the FDA, through major blue bloods in ophthalmology that have been here and built the industry for years. So that's the position I think that if I could have my next time around, how about that? Next time around when I'm reincarnated in something, I think I'll knock on FDA's door and see if I can get lucky there.
Yeah, I've never thought of that. That's really cool. Really, really great answer. What professional role in ophthalmology would you not want to attempt and why?
Yeah, sort of unfortunately, that's also an easy answer. When I first came out of school, I worked in R&D in a lab for the Ohio Agricultural Research and Development Center. After about 4 months, I realized that I felt the same way about the lab job as the lab job felt about me, and that is neither one of us liked each other. In fact, when I went in to resign to my manager and I said, hey, I'm sorry, but I'm resigning. And he said, looked me in the eye and said, thank you. And I said, well, thank you for the work that I did. He said, no, thank you for resigning. So the job I would be, I'm sure, the worst at, and also like the least, would be working in a lab for any company in this industry.
I I hear you. I hear you. Last question for you. If you could do any one thing to contribute to diverse leadership in ophthalmology, what would that be?
I'd make people almost like I want to have a period of time where you could actually point at people and they'd have to stop talking and they'd have to start listening. It's sort of like this magic thing on your finger that would just, when you're talking with people and you realize people really aren't listening or aren't seeing what's going on, you just want to stop them and have them take everything in for just a second. That's one of the biggest problems we've had. Of course, we tell that to everybody from, our kids to whatever, right? That talk less, listen more, and then just think about what you're really hearing, especially now. Because as we know, thank God, things are changing, maybe not as quickly as we'd all want them to be, but in society and everything else, certainly in ophthalmology and everywhere else, we need things to continue to change. We need diversity, not just to be something that people talk about and know about, but people take hold, live with, and really make it flourish throughout our industry, throughout our country, and frankly, throughout this world. So if we could just get people to stop talking as much, maybe listen more and think about what's going on, I think it'd be a wonderful thing.
Oh, well put. And I think that's a great way to end this portion of the interview. And I want to thank you again, but have one last question for you. If you were a beverage, what beverage would you be and why?
Well, it'd probably be easiest for me to be red wine because that's probably constitutes most of my body at this point. But I think I'll just give you one other beverage. I think I would be Fresca, only because I've recently rediscovered Fresca. Because that's something that I used to drink in high school, and it is kind of funny because my wife Dee Dee brought it home, and I said, "What is Fresca?" Wait, we used to have that in high school, and I started drinking, and now I can't stop. So it's somewhat infatuating to me, not addictive, but somewhat infatuating to me, and I think it's just got this fantastic flavor, but it also has this fantastic thought. Every time I drink one, I sort of think about back to things that I did in high school and earlier when I was just growing up, were really fun and really a joy of my life. So that would be it. It would be Fresca. I'd put down the bottle of wine and go more to the Fresca, I think.
I love it. I love it. Okay, Tom, thank you so much. And thank you for Aerie for all of your support of OWL. And I look forward to developing this partnership more with you and your team.
Well, Abigail, thank you. And congratulations to all you and others have done for OWL. You're really making that just an outstanding organization. Good for you. And please let us know how we can help in any way.
Thanks, Tom. Have a good one.
You too.